In yet another bizarre and tragic case, a 35-year-old man in Africa's Malawi died during sexual intercourse with a sex worker. According to a post-mortem report, Charles Majawa's death was a result of excessive orgasm which caused blood vessels in the brain to rupture. Sex has many beneficial physical and psychological effects, including reducing high blood pressure, improving the immune system and aiding better sleep. The physical act of sex and orgasm releases the hormone oxytocin, the so-called love hormone, which is important in building trust and bonding between people. But there's a dark side. People sometimes die during or shortly after sex. The incidence is, thankfully, extremely low and accounts for 0.6% of all cases of sudden death. There are many reasons why this happens to people. In most cases, it is caused by the physical strain of the sexual activity, or prescription drugs to treat erectile dysfunction, for example, or illegal drugs, such as cocaine, or both. The risk of any sudden cardiac death is higher as people age. A forensic post-mortem study from Germany of 32,000 sudden deaths over a 33-year period found that 0.2% of cases occurred during sexual activity. Sudden death occurred mostly in men, average age 59 years, and the most frequent cause was a heart attack, also known as myocardial infarction. Studies of sudden cardiac death and sexual activity from the US, France and South Korea show similar findings. Not just the middle-aged men. Recently, however, researchers at St. George's, University of London, found that this phenomenon is not just limited to middle-aged men. The study, which is published in JAMA Cardiology, investigated sudden cardiac death in 6,847 cases referred to the Center for Cardiac Pathology at St. George's between January 1994 and August 2020. Of these, 0.2%, occurred either during or within 1 hour of sexual activity. The average, mean, age of death was 38 years. And 35% of the cases occurred in women, which is higher than in previous studies. These deaths were typically not caused by heart attacks, as seen in older men. In half of the cases, 53%, the heart was found to be structurally normal and a sudden abnormal heart rhythm called sudden arrhythmic death syndrome or SADS was the cause of death. Aortic dissection was the second largest cause, 12%. This is where the layers in the wall of the large artery from the heart supplying blood around the body tear and blood flows between the layers causing it to bulge and burst. The remaining cases were due to structural anomalies such as cardiomyopathy, a disease of the heart muscle that makes it harder for the heart to pump blood to the rest of your body, or from a rare group of genetic conditions known as channelopathies. This is where the ion channels that let sodium and potassium in and out of the cells in the heart muscle don't work properly. The change to the sodium and potassium in the cells can alter the electrical current through the heart muscle and change the way it beats. An altered heart rhythm can cause a lack of oxygen, myocardial ischemia, and can lead to a sudden cardiac arrest where the heart stops beating. This new study suggests that sudden cardiac death in people under the age of 50 is mainly due to sudden arrhythmic death syndrome or cardiomyopathies. Younger adults who have been diagnosed with these conditions should seek advice from their cardiologist on the risk associated with sexual activity. However, the low incidence of death in these studies suggests the risk is very low, even in people with existing heart conditions. Deaths during consensual sex only account for approximately 0.6% of all sudden deaths. 11. Sildenafil, although generally considered to be a safe drug, has been linked to sudden cardiovascular death during sexual activity among elderly or otherwise infirm men. 11. The majority of deaths due to cardiovascular causes during sex do occur in males. 12. A number of deaths during consensual sex have been linked to the use of other prescription or recreational drugs, such as cocaine. 13. The heart condition endothelial dysfunction is a contributing cause to both atherosclerosis and erectile dysfunction. 14. Because of the link between these conditions, Rates of coronary heart disease are higher among patients with erectile dysfunction. 14. One treatment for erectile dysfunction is cGMP-specific phosphodiesterase type 5 inhibitors, which enable patients to resume having sex despite having a cardiac condition, by lowering blood pressure. 14. These drugs, including sildenafil, inhibit the action of the phosphodiesterase, allowing for a higher concentration of cyclic GMP in the penis when it is physically stimulated. Cyclic GMP is a second messenger in the nitric oxide pathway, responsible for erections via the vasodilating function of nitric oxide. 15. Sudden cardiac death can be caused by myocardial ischemia, and the physical activity of sexual intercourse in patients with coronary artery disease can result in myocardial ischemia. 14. The phosphodiesterase can act as a potentiator for other drugs which lower blood pressure and which could be used to treat heart conditions, and so may be contraindicated to prevent negative health consequences. Some story of people that died during or after sex. Pope John XII died on May 14, 964. One story relates that he died of a paralytic stroke suffered while having sex with a woman named Stefanetta. He may have died instead when the woman's husband defenestrated John or beat him to death with a hammer during the act. Felix IV, president of France from 1895 to 1899, is widely reported to have died while receiving fellatio from his mistress, Marguerite Steinheil. The cause of death was listed as a cerebral hemorrhage. Eyewitnesses stated he was in a state of partial undress. This version is disputed by some historians. Sir Billy Snedden, Australian politician and former leader of the Liberal Party, expired at the peak of physical congresses, as a policeman told Truth, 23, in 1987. 19 years later, his son, and lover of the same woman with whom Snedden was having sex at the time of his death, was quoted as saying, "I'm sure the old man went out happy, anyone would be proud to die on the job." On November 23, 1983, James "Jimmy the Beard" Ferrazzo, a longtime employee of the Condor, the San Francisco topless club made famous by Carol Doda, was killed at the age of 40 while having sex with his girlfriend, Teresa Hill, on top of the club's piano when the couple inadvertently triggered the piano's elevator mechanism, trapping him between Hill and the ceiling. In 2007, a man and woman, both 21, were discovered naked on an empty street in Columbia, South Carolina, with multiple injuries resulting from a fall. Their clothes were later found on the roof of a 4-story building adjacent to the road. Both died in hospital after falling 50 feet, 15 meters, from the downtown Columbia building.